You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. On today's show, we take a very special look at two diseases that until the death of Green Bay Packer All-Pro lineman Reggie White had gone about their business in relative obscurity. So if you snore, toss and turn at night, are fatigued, have headaches, maybe even migraines, or something wrong that no doctor's been able to explain to you, then get ready to hear some life-changing information. Stick around, we'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're in studio with Dr. Leonard Feld. Dr. Feld is a nationally recognized authority on sleep apnea and TMJ and the director and founder of one of the nation's top treatment facilities. Dr. Feld, welcome to the show.
Thank you.
All right, before I brought you on, of course, obviously, I do a little research on you. I found out you're board certified in a multitude of things, including craniofacial pain and implantology. You could have went anywhere in your career. What led you down this path?
Well, that's a really great question, Mike. I was practicing dentistry for quite a while, and I evolved into implantology, and that was my main crux of dentistry for quite a while. And then I found that patients that we were doing implants on, or patients that came from other offices that had implants done, were having pain. And as we looked into it more, it wasn't necessarily the implants, but I found out that they were having pain in their jaw area, or that was giving them pain elsewhere. And the people that had this also had headaches, they had migraines, they had dysfunctions of a multitude of things, including backaches, neck aches. They weren't sleeping at night. They would wake up tired. They were losing their memory. They were dropping things, and their balance was off. These things all came about, and that's how I evolved into it. I decided to study more about it.
So you didn't really mean to get into it. When doing the implants and the implants were failing, you thought it was the implants, but come to find out, it was their bite wasn't right.
Right. It was the way the teeth came together, and their jaw maybe not having a structural integrity that didn't fit right, and that led into with the pain situation.
All right. I'm gonna ask you, because when I first heard about this, and I called you up to see if I could interview you, I didn't understand how my jaw joint would have anything to do with, a headache. Well, obviously if I got hit in the jaw, but just talking would give me a headache, or make my arm go numb, or my hands numb, or give me a backache. So that everybody understands, take a moment and kind of explain to us how your jaw joint can affect the rest of your body.
It turns out there are a lot of nerves and blood vessels that enter the area behind the jaw joint. And when they're impinged upon, it creates pain or dysfunction in other areas of the body.
So you're saying that where the joint moves, right behind it, there's nerves and blood vessels?
Yes. Let me show you.
Okay.
Let me show you. This is a skull. Okay. And this is the temporal bone, and this is the mandible. Where they come together, they call this a joint. Okay. Just like your elbow, right, or your knee, right? And so the way this works is it slides. It slides, it opens and slides, okay? And
now, it does that by design. I mean, that's how your body works.
Yeah,
it's supposed to do
God
that.
made it happen this way, right? And he put a little pillow here. Okay. So it would slide very nicely, okay? And due to maybe a macro trauma, a car accident, falling off a bicycle, getting hit on the head, just falling down.
Talking too much?
Well, in your case, that would be a micro trauma. Or teeth being out of the line, teeth not hitting in the right place. Right. For various reasons, because of disease or because of just something happening, now can dislodge this little pillow that sits here, which is supposed to stay on the jaw. And when this little pillow comes off, the jaw then goes too far back, and it hits these nerves and blood vessels that are behind the jaw that go to the ear and go to the brain.
So wouldn't you feel that right in your jaw joint? Wouldn't you notice that?
Not necessarily, because those nerves go to the brain, and then the brain says, ooh, I got a problem somewhere else.
So if the nerve goes through that joint, and let's say it's the nerve that ends at my wrist, and that joint comes out of whack and presses on that nerve, I'm going to literally feel the pain at the nerve ending in my wrist?
In fact, I've got a little example here of when the jaw joint goes back too far and hits for instance, the superficial temporal artery, which is a big word, but you can see that there's vessels here and nerves. And when this jaw joint hits this, it impinges on this, which means it cuts off the circulation.
Kind of like stepping on a garden hose. So then the blood doesn't get to my brain anymore.
Right. What do you think happens when you don't get blood to your brain?
Oh, I would either think it's kind of, you'd either get a headache or your brain would start to do like your hand when you don't get blood to it. You know, it goes numb, and
Why did that happen?
there wasn't a good enough circulation.
Very-
I hear about circulation all the time. Everything where I go, people say, oh, your circulation. What causes the pillow to become dislodged? I mean, is there something I would know if maybe I was having pains or migraines, or would there be any set signs that I might be having jaw joint disorder? Is there clicking or my teeth banging together? Or?
Well, a lot of people have clicking. Some people have the problem without the clicking. What the clicking is with the pillow coming on and off the jaw, the lower jaw joint, the mandible. When it comes off, let's say it slides forward, that's the click that you hear.
So when the pillow gets out, then the clicking, is it popping? Because you came here today, and before we came on to do this show, one of the assistants here, I was talking to her, and you were talking to her, and she said, "Oh, my jaw's clicked my whole life." So and didn't think it was any big deal. And you started doing what you told me, you showed me, and you told her everything that was going on in her life, all the things, her becoming dizzy, bumping into walls, dropping stuff, not being able. You went through all that without her telling you, based on basically the tests you did on her, and she seemed to think that her jaw clicking was perfectly fine. And to be honest with you, I did too.
Well, the jaw clicking is nothing more than as the jaw goes forward, the pillow is supposed to stay on top of it, so it articulates, or it is the sliding mechanism. Okay, when that pillow comes off, it's now kind of
Hitting on the bone and going wherever it's supposed to.
Exactly, and it also, when it comes back, it doesn't have the pillow on it, so now it hits blood vessels and nerves.
But you told me it doesn't necessarily have to click to have something, because I have one that doesn't click, and there's something wrong.
Well,
with
it could be gone altogether, and it just doesn't come back on. It just the pillow. The disc just stays there, it never gets back on, and now it's just rubbing on bone and rubbing on nerves and vessels.
I came out to your office prior to you coming on, because I want to make sure that what you tell me is true. And I spent the day at your office, and I talked to some of your patients, and one of them so impressed me that I ran out to my car and got my video camera and I recorded her. And I want to take a look at that with you. We've got to take a quick break, so we come back, we're going to watch that video.
Why didn't you tell me about this before?
Well, it's because I wanted to see, I didn't want anything rehearsed. I didn't want you giving me patients that were, oh, here, talk to this one and this one. So I spent the day in your office. When we come back, we're going to look at that video, we're going to watch it, and then you're going to tell me if that's typically what a patient goes through. You're watching Medical News Network. We're in studio with Dr. Feld. We'll be right back.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Welcome back. We're in studio with Dr. Leonard Feld talking about TMJ, or TMD, and sleep apnea, two diseases that affect millions and millions of people's lives that very little is known about. All right, Doc, before we went to break, I told you I'm going to show you a video. I spent a day in your office talking to your patients, all kinds of stories, people that have been to all kinds of doctors, some stories better than others. This lady in particular, I spent probably an hour and a half with her.
Really?
And she took me on an emotional ride. She took me through, well, let's just watch the video, and then when we're done, I want to ask you if basically you see this all the time with people.
Okay, my problem started about 7 years ago. I had a surgery, hysterectomy, and when I came out of the surgery, for some reason I just began to get migraines, about 20 a month. which means I had no life. I was in horrid pain. Just everything was over for me at that point. So I began to search for answers, and I went to see all kinds of doctors. I went to see 3 different neurologists, hormone specialist, endocrine specialist, acupuncture, Chinese herbalist, alternative doctors. I just pursued health as much as I can because I wanted to live. Life was good, and I couldn't live with that kind of pain. Migraines were debilitating. They would come up one side of my head. They would consume my head with pain. The ones I had were so bad, painkillers, the most they could send me home with would not take care of the pain. I would have to go in a dark room, just lay there. Light hurt my eyes. I was just in terrible pain. A lot went downhill. I mean, I had to reduce my life to like you would spend money. I had this much energy, you know, during the days I didn't have a migraine, where I could only take care of my children, barely have a life with my husband. I couldn't make appointments with friends because I was sick. I was very isolated during that time because you can't live with that kind of pain. You just can't plan anything because you don't know what days you're going to have them. It was just quite miserable. You know, they never really completely diagnosed it. They just gave me medications to try and deal with the symptoms, which was, you know, bless them, they tried to do their best, but honestly, it tore up my stomach. A lot of the medications, it caused other problems, but I tried everything. They thought maybe it was the hormones. They thought, you know, there was never really a clear answer. Nobody really had the answer. They did MRIs, they looked fine. All the tests, the x-rays, everything they did looked fine. And they found nothing, so they just treated the symptoms. When there's no answer and something painful like that, but there's no reason that they can give you, and if you don't fit into the little box, you know, of what they have, you know, yeah, you do feel like you're crazy. I had gotten so desperate, I was really at the end of my rope. I had even prayed, you know, Lord, give me a shovel to bury myself or fix this thing. So 2 more days later, I met Dr. Feld accidentally. He was visiting a hormone specialist, walked into my appointment, and this doctor asked him, well, what do you think about her? She's got hormone problems. And Dr. Feld took one look at me and he said, let me show you something. And what he discovered just right away that nobody else had looked at, nobody else had considered that this would be a problem. My right shoulder was lower than the left. My right arm was about 2 inches longer, and he stood me up and did some touching and testing, and there was pain where he touched. Nobody had ever checked that. And he immediately found, it said the problem's structural. If you have a structural problem, no medication can fix you. You have to fix the structure first. And that made so much sense to me. And I've drove a long way. I drive 2.5 hours to get here, and it's been worth it. It's changed my life. I have a life. After Dr. Feld put the appliance in my mouth, within a week my migraines lifted and lifted, and they were so mild, and then they completely left. I was so open to anything, but yes, when he came in, he touched here. Is this a problem, this problem, this problem, look at this. He had the answer like that, and I thought, it can't be that simple. I've seen doctors and neurologists, I've seen dozens of doctors with all kinds of fields. How could it be that simple? So yeah, there was like, could it really be that simple? And it turned out it was. It was so much. It was 80 to 90% of the problem. And like I said, where I had no life, I have one now. He's given me no drugs. He gave me a vitamin C, and I think glucosamine, which is, you know, just an over-the-counter vitamin type thing that lubricates the joints. And that was it. No medication. And I tell you what, I'd had surgeries, and I don't think I could have gone through another surgery. And for his answer to be, no surgery, let's fix this with no surgery, within a week, my arm, and I don't know how a jaw, you know, you fix one thing and the rest of it starts fixing itself. And they had me, you know, working with a chiropractor. My arms were the right length. and my shoulder was up. Fixing one part of the structure, the rest of the body fixes itself. It was just blew my mind. Absolutely. I know that there's other people out there that have tried everything and they found no answers. And no, it's just not out there to look for this. I had never heard of TMJ. I never had a clue a jaw could cause all of these problems. So I never knew to look, and I know there's other people, they don't know to look there.
Okay, I spent a lot of time with her. She almost, I was just going to tell you, this lady almost made me cry. And I don't know that, had I spoke to her first during the day, that it would have had the same effect on me, but I talked to all kinds of people. And when I got to her, she said that about you, but she's a singer. She'd given up her career. Her life had gone, and this lady for 7 years spent her life savings trying to find an answer to a problem. And you walked into her life, and it was so simple that I didn't want to believe it at first, and I know she didn't either, but do you see this all the time?
Yeah, I see it a lot. And
by the way, she cut 2 new albums, and they're wonderful. She gave me a copy. They're great.
yeah, well, it was. I really didn't know she was an accomplished singer. I didn't know she was a professional singer. I wasn't really introduced to her. I mean, the doctor said, I'm having a problem with this patient. I've been
She was at the hormone doctor.
Right, and he'd been treating her for 3 years, and he knows what he's doing. He's really sharp. And he said, I just can't seem to get her to the right place. And so he asked me to take a look at her. And I was there actually for my son, to help him. And so that's how I met her. So I didn't know who she was or what the problem was or anything like that. And when I walked in, I saw that she was crooked. And so I had a hint. And he had told me that she had serious headaches and migraines, and she was on disability. And that's usually a clue that something's wrong. And she'd been everywhere, like she said, and I didn't know that either then. I did ask her, I think, if she had MRIs taking and CT scans, and she had, which now I'm ready to go, because she didn't have any major pathology. In other words, no tumors or anything else that I had to worry about or concern myself with, that I could just deal with the structural problem if there was one. And so
she made that point that you told her, and it didn't really dawn on me, that if it's a structural defect, if the walls are falling down, or that just putting more and more medicine on top of it doesn't fix anything. It just masks the symptoms of the problem.
Right.
And what happened is those problems just kept getting worse and worse. And she, I didn't go into it much here, but she told me she started having ulcers from the medicine she was taking, and she took the stuff she told me she took, I don't know how she functioned. But for 7 years, she went to all kinds of doctors that kept giving her more and more and more. And then here you come and say, no, you don't need any of that. You just need to fix your structure. Do you find that people, I'm gonna tell you, Doc, I was completely skeptical. That's why I came down for the day. I thought you were out in left field somewhere. But I talked to those people. Do you find that most people are just amazed or awed the fact that one little joint can create such a problem?
Well, they don't know. And if you don't know, you don't know. And I'm kind of last resort, I guess. They go everywhere, and then...
I ask you because she'd been to all kinds of medical doctors, and a dentist fixed her problem. Wouldn't most people, at least I would, think that would be something you would go to a medical doctor for? But obviously none of them ever checked it on her.
Well, it's a medical problem with a dental solution. So the MDs, or the physicians, may or may not recognize it. They don't get taught it, but it is a medical problem. The dentists are kind of like in limbo because they don't want to go into the medical field because that's not their territory. And quite frankly, it takes a lot of extra education to learn about that. And so we have gotten into a world of specialization where everybody does their thing and adding more onto it. And every year there is more to do with whatever you were doing in the first place. So why would you want to go outside your realm to try and get into something else again? I was kind of forced into it because I just wanted to help my patients, and I found out that these pains were associated with something. And the other thing is, in our society, is we're dealing with symptoms. Everybody treats symptoms. They don't come up with a diagnosis. They have a headache, so they take headache medicine. They have a backache, they take backache medicine. They have depression, they take depression medicine. They have anxiety, they take anxiety. Well, what's causing all that? That would be, I think, a way to approach it.
Okay, she says you treated her with no medicine other than vitamin C and some kind of joint lubricant. How hard is it to treat? What do you do?
Well, I think you have to take it from the top. You just can't treat it unless you can decide what it is. I mean, you have to really find out what it is. And so we go through a complete comprehensive examination. Intraoral, we look at intraoral habits to see what's wrong with the mouth. We try to take a look if there's any pathology there that's visible. And then what causes that to happen? We take special x-rays, so you have to be able to be trained in that field. And so it's a lot of things we put together. I just did some neurological testing on her real quickly because I already had been introduced that she had all these problems. If a person has something like that, where if they have neck ache, backache, they don't sleep well, they wake up tired, they're starting to forget things, they have back problems, or in the afternoon, low back problems. It's usually a postural problem or a structural problem. Why is it happening? So, I mean, people should ask themselves that question. And why is it happening?
I want to go into a little bit more about the treatment of it. We've got to take another quick break. When we come back, I want to talk a little bit about that, and then I want to touch a little bit on sleep apnea, if that's okay with you. You're watching Medical News Network. I'm Mike Wittgenstein. We'll be right back.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
You know, parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
Oh, you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community. ConnectForKids.org, guidance for grown-ups.
Welcome back. We're in studio with Dr. Leonard Feld talking about TMJ and how it affects everyone's life and how easy it is to cure it. All right. We talked about the cause, the cures, people not being aware of what's going on. How many people do you think today on the face of the planet are walking around in pain that they don't need to be, taking drugs they don't need to take? And I know it's putting you on the spot, and I know you asked me not to do it, but I know in my little realm of friends, you know, I talked to everybody about what I was going to talk to you about, and it's amazing. They started going, oh, well, I just thought my you know, my hands were numb because I work on the computer. I thought, you know, I was this because of that. We tend to all make reasons and excuses. Her case was severe, but it got there for a reason.
Right.
If she'd have caught it earlier, if something had happened and earlier in her life, she could have caught that or stopped it or found it right when it happened. Why do you think people don't go get tested? Is it because they don't know? Is it because there's no information? Is it because they're afraid? What do you think?
Well, it's almost too big of a question to answer. Like, we do what we've been trained to do. If you have a headache, you go to see your physician because you have a headache or migraine. If you have an earache and your ear bothers you, or you're tingling, or you have voices or ringing in your ears, well, you're going to go see an ear specialist, right? Right. If you have backache, who are you going to go see? You go see a chiropractor if your hip hurts or something. Right. So that's what we do. And unfortunately, no one's looking at the total picture. They're just trying to isolate on that. I had a patient that came in because this hurt over here. So they wanted us to do a root canal, and so the doctor couldn't find anything wrong with it. So he brought it in to me, and I take a look at it too. And I said, well, let's check this. And I found out that it was referred pain from her jaw. But it was referred for me to do a root canal on. So people, unfortunately, do what they do, and they do what they know. And how is someone supposed to know that their low back or their hand is associated with their jaw? Where would they learn that?
That's a good point. I just want everybody to know that if you have pain that's unexplainable, if you or you've been treated for it. I mean, again, 7 years and 13 doctors that I counted she had gone to, and 13 doctors had given her medicine, given her hormones, and obviously the doctor was good. He's a very well respected doctor, but giving them hormones and giving her medicine all of them were treating symptoms. When she told me that you said it's a structural problem, you know, I thought about that and I thought, you know what, if the structure, if the building's not built good, you can put all the paint on it you want, it's still gonna fall down.
Right.
So what kind of symptoms if someone has, if you could share some information with someone, if you're having these certain symptoms, please go get checked by somebody. How would somebody find a dentist that deals with TMJ?
Well, the same way they would find anybody that is associated, or if they wanted to have plastic surgery, what would they do? I mean, it's a great. What do you think? How do you think?
I found you by accident. I found you through somebody telling me what was going on. Do you have information? Because we're out of time. Do you have information on your website?
Yeah, there are websites, there are organizations that they can check into. The American Academy of Craniofacial Pain, the American Academy of Orofacial Pain, and there's thousands, literally thousands of dentists and physicians now that are getting involved to try and cross over and treat people that have these problems.
All right, I'm going to put you on the spot. If somebody's at home, they've got pain, they've got problems, they have questions, they have concerns, they don't know where to go, they don't know who to turn to. I talked to your staff, they're very well educated, they're very nice people. Is it okay?
Thank you.
And I was going to start to say it's okay if they're out of the area, they call you. This lady drives from Palm Springs, California to your office in LA. She told me 2-3 times a month. I hate to drive, but it was just so incredible. If they call, will you help them find someone in their area or help them to?
We're in the process of trying to do that, to try and get all the guys together and that have been trained to help people. Yes, I had someone that flew in from Austria last week that heard about me and was just dying of pain and couldn't function anymore. He was falling asleep driving, and he's a professional limo driver, so that's his business. And so he had been in several accidents, close to accidents, falling asleep, and so he came out to see me because he heard through someone who's through someone, I don't know how, I don't remember exactly, but he was there, and we figured out real quick, and within 3 days he was sleeping.
You know, we don't have time to go into it, but just real quick, you had told me that part of the problem is that people, they toss and turn, they don't get good sleep because of it. You tend to wake up,
right.
You know, and it does cause you to be fatigued. So I did a little research, and I found out that more accidents are caused by tired and sleepy drivers than by drunk drivers, by far.
I didn't know that.
And again, we don't see much about this. So I really want to thank you for coming on today. I really want to thank you for what you're doing. I probably should come see you. And I just want to thank you for everything that you've put in and all the time. It's an incredible thing.
Thank you.
You've been watching Medical News Network. I'm Mike Wittgenstein. Until next time, I wish you good health.